Have you ever woken up feeling utterly drained, even after a full night's sleep? Or perhaps you sometimes walk feeling as if the floor beneath you is shifting, or those familiar tingling and burning sensations in your hands and feet come and go, especially in the evenings? If you're living with diabetes and are in your middle years or beyond, these feelings aren't just signs of aging. They could be your body sending you a clear message. Have you ever wondered why, despite your diligent efforts to manage your blood sugar, persistent symptoms like brain fog, chronic fatigue, or nerve pain continue to weigh you down? The secret might lie in something often overlooked: critical vitamin deficiencies that silently impact your health every single day. In today's video, we're going to dive deep into 3 of the most vital vitamins that millions of people with diabetes, especially those over the age of 50, are alarmingly deficient in. I won't just tell you what they are, I'll explain why these deficiencies occur, how they impact your body and quality of life, and most importantly, how you can safely and effectively replenish them to help you reclaim your energy, sharpen your focus, and take back control of your health. Stay with us because this information could truly be life-changing. Hello, I'm Dr. Michael Bennett, a nutritionist with over 20 years of experience, and our mission is to bring you science-backed, easy-to-understand health knowledge, especially concerning diabetes management, so you can live a fuller, healthier life. Today, we're uncovering 3 often overlooked, silent superheroes inside your body: vitamin B12, folic acid, or more accurately, L-methylfolate, the active form of B9, and P5P, the active form of B6. You'll gain a clear understanding of their pivotal roles in blood sugar management, nervous system health, energy production, and overall well-being for people with diabetes. This isn't just information. It's a key to feeling better every single day, to unlocking a more vibrant you. Please remember that the information shared in this video is for educational purposes only and should never replace professional medical advice. Always consult with your healthcare provider before starting any new supplement regimen or making significant changes to your health plan. Your doctor is your best resource for personalized care. If you're ready to unlock these vital health secrets, go ahead and hit that subscribe button now to join our growing community and receive weekly health insights. And don't forget to click the notification bell so you won't miss any of our valuable upcoming videos. Let's get started. The unseen battle: why diabetics are prone to vitamin deficiencies. Diabetes is far more than just elevated blood sugar levels. It's a comprehensive challenge to your entire body, subtly impacting every system from your nervous and cardiovascular systems to your metabolism and energy production. One of the most insidious silent enemies in this battle is the chronic depletion of essential vitamins and minerals. It's an unseen battle that many are fighting without even realizing it. So, why are people with diabetes particularly vulnerable to these critical deficiencies? There are several key reasons, and understanding them is the first step toward proactive health management. Firstly, medications play a significant role. One of the most common culprits is metformin, the world's most widely prescribed medication for type 2 diabetes. While incredibly effective at controlling blood sugar, metformin is also notorious for being a vitamin thief. It can significantly deplete your body's stores of crucial nutrients, particularly vitamin B12 and folic acid. This isn't a side effect that's widely discussed, yet it impacts millions. Secondly, many individuals with diabetes adopt strict dietary regimens in an effort to control their blood sugar. While healthy eating is paramount, sometimes these restrictive diets can inadvertently eliminate important sources of vital vitamins, leaving gaps in your nutritional intake. It's a delicate balance to achieve comprehensive nutrition while managing specific dietary needs. Thirdly, the natural process of aging contributes significantly. As we get older, our bodies become less efficient at absorbing vitamins and minerals from the food we eat. Our digestive systems may produce less stomach acid, which is crucial for nutrient breakdown and absorption. This age-related decline in absorption is exacerbated in individuals with diabetes, making them even more susceptible to deficiencies. And finally, the very nature of diabetes itself increases your body's demand for certain nutrients. Chronic inflammation, which is often a hallmark of diabetes, along with the metabolic imbalances associated with the condition, can elevate your body's need for specific vitamins to repair, function efficiently, and maintain overall health. Your body is working harder, and thus it requires more fuel and more building blocks. Understanding these underlying causes is the fundamental first step. It empowers you not only to manage your blood sugar effectively, but also to proactively address potential deficiencies, leading to a much improved, holistic quality of life. Let's now unveil the first of our 3 critical vitamins. Vitamin number 1. Methylcobalamin, B12, the guardian of your nervous system. Have you been experiencing persistent numbness or tingling sensations in your hands and feet, perhaps feeling like pins and needles, or even a burning sensation? Do you find yourself struggling with balance, or perhaps becoming increasingly forgetful? Are you experiencing unexplained dips in your mood or energy levels? These could be the subtle, yet concerning, early warning signs of a vitamin B12 deficiency. Let me share a common scenario. Imagine a woman named Carol, a 68-year-old with type 2 diabetes. She approached her doctor, expressing deep concern that her feet felt constantly asleep and that she was stumbling more frequently. Her memory, once sharp, was becoming increasingly unreliable. After thorough blood tests, it became clear that Carol was severely deficient in B12, and the primary culprit was her long-term use of metformin, which she had been taking for over a decade. Her story is not unique. It's a pattern seen in countless individuals. So, what exactly is methylcobalamin, and why is it so incredibly vital, especially for someone with diabetes? Methylcobalamin is the bioactive, readily usable form of vitamin B12. Unlike cyanocobalamin, which is the synthetic form commonly found in many supplements and fortified foods, methylcobalamin doesn't require your body to convert it into an active form before it can be utilized. This is a crucial distinction, as many individuals, particularly those with certain genetic variations or digestive issues, struggle to efficiently convert cyanocobalamin into its active state. B12 is essentially the master engineer for your entire nervous system. Its primary role is to help build and maintain the myelin sheath, that critical protective layer that surrounds your nerve fibers, much like the insulation around an electrical wire. This myelin sheath is essential for rapid and accurate transmission of nerve signals throughout your body, from your brain to your fingertips and toes. Without enough B12, this insulation can break down, leading to a cascade of neurological problems. Now, who is most susceptible to B12 deficiency, and why should those with diabetes pay particularly close attention? As we discussed, metformin is a major factor. Research indicates that up to 30% of individuals who have been taking metformin for over 4 years, and even at lower doses, face a significant risk of B12 deficiency. The mechanism is clear. Metformin interferes with B12 absorption in the small intestine, essentially blocking its entry into your bloodstream. Age is another critical factor. A staggering 15 to 20% of people over the age of 60 are already deficient in B12, often due to a natural decline in stomach acid production, which is necessary to release B12 from food for absorption. When you combine aging with diabetes and metformin use, the risk skyrockets. Dietary choices also play a role. Individuals following vegetarian or vegan diets are at higher risk because B12 is primarily found in animal products. If you don't consume meat, dairy, or eggs, you must proactively seek out fortified foods or supplements. Furthermore, various digestive issues, such as atrophic gastritis, a thinning of the stomach lining, or the long-term use of acid-blocking medications like PPIs, proton pump inhibitors, can severely impair B12 absorption, compounding the problem. The impact of B12 deficiency on your body, especially for someone managing diabetes, is profound and far-reaching. Nervous system damage, neuropathy as myelin breaks down. Nerve signals become distorted or fail altogether. This exacerbates and can even cause painful diabetic neuropathy, symptoms like numbness, tingling, burning, and sharp pains, particularly in the hands and feet. This is why addressing B12 is so crucial for nerve health. Brain health and cognitive decline. B12 deficiency can lead to severe brain fog, memory loss, and even brain shrinkage. Studies have shown that low B12 levels can increase the risk of cognitive impairment and dementia by up to 6 times. You might struggle with concentration, recall names, or feel generally slow mentally. Energy levels and blood production. B12 is essential for DNA synthesis and the production of healthy red blood cells, which carry oxygen throughout your body. A deficiency can lead to macrocytic anemia, leaving you feeling profoundly fatigued, weak, and utterly exhausted, even when you haven't exerted yourself. Cardiovascular health. B12 plays a vital role in breaking down homocysteine, an amino acid that, when elevated, is a known risk factor for heart disease and stroke. Without sufficient B12, homocysteine levels can rise, significantly increasing cardiovascular risk, which is already a major concern for people with diabetes. So, how can you effectively address and prevent B12 deficiency? First and foremost, ask your doctor for a blood test to check your B12 levels. If possible, also request a homocysteine test. Ideally, your B12 levels should be above 500 pg/ml, not just within the normal lab range, as symptoms can appear even at seemingly normal low levels. In terms of food sources, organ meats like beef liver are incredibly rich in B12, with a single 3-ounce serving providing 70 to 80 micrograms, far exceeding your daily needs. Other excellent sources include clams, sardines, salmon, eggs, and dairy products. For vegetarians or vegans, B12, fortified nutritional yeast is an excellent option. For supplementation, methylcobalamin is the superior form. Common oral doses range from 1,000 to 2,000 micrograms per day. In cases of severe deficiency with clear neurological symptoms, your doctor might initially recommend B12 injections, typically once a week for the first month, followed by monthly injections, as this method delivers B12 directly into the bloodstream for faster action. Here's a helpful tip. If you are taking metformin, consider supplementing with calcium, around 1,200 milligrams daily, as it can help improve B12 absorption. Finally, remember that B12 is remarkably safe. It's a water-soluble vitamin, and your body will simply excrete any excess through your urine, making toxicity highly unlikely even at higher doses. Prioritizing your B12 levels is a powerful step toward protecting your nerves, sharpening your mind, and boosting your energy. Vitamin number 2, L-methylfolate B9, the commander of brain and heart health. Do you ever find yourself experiencing persistent brain fog even after a restful night's sleep? Perhaps you're becoming increasingly forgetful about simple things, or those nerve-tingling and pain sensations seem to intensify, never quite vanishing. The answer to these frustrating symptoms might lie with folic acid, or more precisely, its active form, L-methylfolate. Consider the case of David, a 75-year-old gentleman who frequently complained that his memory was steadily deteriorating. He often felt anxious and at times even exhibited mild signs of depression. He had been taking a synthetic folic acid supplement for a while but saw no significant improvement. After his doctor suspected a genetic variation and tested him for the MTHFR gene mutation, he switched to L-methylfolate. The change was remarkable. His cognitive clarity improved significantly and his mood stabilized. So, what exactly is L-methylfolate and why is it so crucial? Folic acid is the synthetic form of folate, commonly found in many fortified foods like cereals and bread, and in most standard vitamin supplements. However, for your body to actually use this folic acid, it must first be converted into its active form, L-methylfolate. This conversion process is complex and involves an enzyme called MTHFR methylene tetrahydrofolate reductase. And here's a critically important point. A significant portion of the population, an estimated 10 to 15% of the general population and potentially even higher in certain groups, carries a genetic mutation in the MTHFR gene. This mutation severely impairs their body's ability to convert synthetic folic acid into its active, usable L-methylfolate form. This is precisely why opting for L-methylfolate directly is often a superior and more effective choice, ensuring your body can immediately utilize this vital nutrient without relying on a potentially faulty conversion process. Now, let's address a serious concern: the danger of folic acid masking a B12 deficiency. This is a critical warning you must take to heart. Taking too much synthetic folic acid can dangerously mask the symptoms of a B12 deficiency. Why is this so dangerous? Because an undetected B12 deficiency can lead to irreversible and permanent nerve damage. You might feel a little better from the folic acid, but the underlying severe B12 problem continues to worsen silently, eroding your nervous system. This is why you should never self-supplement with high doses of folic acid without first consulting your doctor and having your B12 levels thoroughly checked. It's an essential safety measure. Who is most likely to be deficient in folate, and why is it especially important for people with diabetes? Just like B12, metformin, the widely used diabetes medication, is known to lower folate levels in the body, typically by about 15 to 20%. This direct interference further compounds the risk for those managing their blood sugar with this medication. Insulin resistance, a hallmark of type 2 diabetes, also increases the body's demand for folate to maintain healthy metabolic functions. The body needs more of this nutrient to cope with the metabolic stress. Furthermore, a significant number of individuals with diabetes, specifically 40 to 50% of those with folate deficiency, exhibit elevated homocysteine levels. As we discussed earlier, high homocysteine is a dangerous independent risk factor for cardiovascular disease and stroke, problems that are already highly prevalent among people with diabetes. Again, aging plays a role. Our ability to absorb and convert folate can decline after age 50, making adequate intake more challenging. And, as mentioned, the MTHFR gene mutation directly impacts your body's ability to process folate efficiently, making the active form, L-methylfolate, a necessity for many. The impact of folic acid deficiency on your body, particularly when you have diabetes, is extensive. Brain health and mood. Folate is absolutely essential for the production of crucial neurotransmitters, including serotonin, dopamine, and norepinephrine. These are the chemical messengers that regulate your mood, sleep, and cognitive function. A deficiency can manifest as clinical depression, heightened anxiety, irritability, and significant cognitive decline. DNA synthesis and cell production. Similar to B12, folate is vital for DNA synthesis and the production of healthy red blood cells. A deficiency can lead to macrocytic anemia, resulting in overwhelming fatigue, weakness, and overall exhaustion. Cardiovascular health. One of folate's most critical functions is to work in conjunction with B12 and B6 to break down homocysteine. Without enough folate, homocysteine levels build up, causing damage to blood vessels and significantly increasing the risk of heart attack and stroke. This is a particularly pressing concern for individuals with diabetes, who are already at elevated cardiovascular risk. So, how can you effectively optimize your folate levels? Begin by asking your doctor to test your blood folate levels. If there's a strong clinical suspicion or you've struggled with symptoms despite supplementation, you might also consider asking about MTHFR gene testing. When it comes to food sources, leafy green vegetables like spinach, kale, and collard greens are fantastic sources of natural folate. Legumes such as lentils and chickpeas, and citrus fruits like oranges also provide good amounts. Prioritize whole, unprocessed foods over heavily fortified grains, as the synthetic folic acid in these products might not be effectively utilized by everyone. For supplementation, always prioritize L-methylfolate, the active form, over synthetic folic acid, especially if you suspect you might have an MTHFR gene mutation or are currently taking metformin. Common daily doses range from 400 to 800 micrograms. In more severe cases or for specific clinical needs, your doctor might recommend doses up to 1,000 micrograms per day, but this should always be under medical supervision. Regarding safety, L-methylfolate is generally very safe, and any excess is typically excreted through your urine. However, it's important to be cautious with very high doses, particularly above 1,000 micrograms per day, especially if you have kidney issues, as higher doses can potentially place an extra burden on your kidneys. Always discuss appropriate dosing with your healthcare provider. Addressing your folate levels effectively can significantly improve your brain function, mood, and cardiovascular health, truly enhancing your overall well-being. Vitamin number 3. P5PB6. The metabolic maestro and energy regulator. Do you frequently find your blood sugar levels swinging wildly, making them difficult to stabilize? Are you grappling with persistent insulin resistance, feeling like your body isn't responding well to insulin? And are those pins and needles or burning sensations in your hands and feet becoming increasingly bothersome, perhaps even worsening? P5P, the active form of vitamin B6, might just be the missing piece of your health puzzle. Let me share another illustrative story. Take Susan, a 62-year-old woman with diabetes who always felt perpetually fatigued and experienced frequent mood swings, despite her blood sugar being fairly well controlled by her medications. After consulting with a functional nutritionist, she began supplementing with P5P. Within a few weeks, Susan noticed a significant boost in her energy levels, her mood became much more stable, and even the tingling sensations in her feet began to subside. Her story highlights the subtle yet profound impact P5P can have. So, what exactly is P5P pyridoxal 5-phosphate and why is it so incredibly important, particularly for those with diabetes? P5P is the coenzyme or the active form of vitamin B6. Just like methylcobalamin, B12, and L-methylfolate, B9, P5P doesn't require your body to undergo any conversion processes before it can be used. This means it's readily available for your body's biochemical reactions, making it far more absorbable and effective. This direct usability is especially crucial for individuals who may have liver issues, which can impair B6 conversion, or those with genetic variations like the MTHFR mutation, which affects up to 30% of the population and can impact the entire B vitamin metabolic pathway. P5P truly acts as a maestro in regulating your blood sugar and enhancing insulin sensitivity. Its roles are multifaceted. Firstly, P5P plays a pivotal role in the metabolism of glycogen, the stored form of glucose in your liver and muscles, helping convert it into usable glucose when your body needs energy. This helps prevent sudden drops in blood sugar and ensures a steady energy supply. Secondly, and perhaps even more critically for diabetics, P5P supports the healthy secretion of insulin from your pancreas. More importantly, it improves the function and responsiveness of the insulin receptors on your cells. This means your cells can more effectively absorb glucose from your bloodstream, leading to better blood sugar control and a reduction in insulin resistance. This is a game changer for many individuals striving for stable glucose levels. Numerous studies indicate that a significant percentage of people with diabetes, ranging from 50 to 70%, may be deficient in B6. And yes, metformin, our common diabetes medication, can also negatively impact the absorption and utilization of B6, adding another layer of risk. The widespread, multi-system impact of P5P on your body is remarkable. Nervous system health and neuropathy relief. P5P is absolutely vital for nerve regeneration and protection. It helps maintain the integrity of the myelin sheath around nerve fibers, similar to B12, and is crucial for repairing nerve damage. This makes it an invaluable ally in reducing the uncomfortable symptoms of diabetic peripheral neuropathy, such as numbness, tingling, and burning sensations. Mood and mental well-being. P5P is a key cofactor in the synthesis of several essential neurotransmitters that influence mood, sleep, and stress response. These include serotonin, our feel-good hormone, dopamine, involved in pleasure and motivation, and GABA, a calming neurotransmitter. A deficiency in P5P can lead to symptoms like depression, increased irritability, anxiety, and even difficulty sleeping. Cardiovascular health. Just like B12 and B9, P5P is indispensable in the methylation cycle, helping to convert the harmful amino acid homocysteine back into methionine, a harmless amino acid. By lowering elevated homocysteine levels, P5P significantly contributes to reducing the risk of cardiovascular disease and stroke, a major health concern for those living with diabetes. So, how can you effectively replenish your P5P levels? When it comes to food sources, fish like tuna and salmon are excellent providers of B6. Other good sources include chickpeas, potatoes, and bananas. For instance, a 3-ounce serving of tuna can provide about 1 milligram of B6, which is roughly 50% of your daily recommended intake. For supplementation, P5P in its active form is the most effective choice. Common daily doses for P5P range from 25 to 100 milligrams. In certain more severe cases or under the close supervision of a healthcare professional, doses up to 200 milligrams per day may be recommended to address specific deficiencies or symptoms. In terms of safety, P5P is generally very safe when taken within the recommended dosage range. However, it's crucial to be aware, extremely high doses, typically exceeding 500 milligrams per day and taken for extended periods, can, in rare cases, lead to nerve damage. This is why it is absolutely essential to always consult with your doctor or a qualified pharmacist before taking high doses of any supplement, including P5P. They can help you determine the appropriate dosage for your specific needs and monitor your progress safely. Incorporating P5P into your regimen can offer remarkable benefits for your blood sugar stability, nerve health, and overall mood, giving you a powerful tool in your diabetes management toolkit. Holistic Health Blueprint. Total well-being beyond blood sugar. So, we've journeyed through the critical roles of 3 essential vitamins, methylcobalamin, B12, L-methylfolate, B9, and P5P, B6, and how they can serve as powerful allies in your diabetes management journey. from protecting your nervous system, boosting your energy levels, enhancing brain function, and supporting cardiovascular health, to stabilizing blood sugar regulation, their importance cannot be overstated. These are not merely supplements. They are foundational nutrients vital for your body's optimal performance. Now, let's step back and consider these vitamins within a larger framework, your comprehensive, holistic health blueprint. Think of these vitamins as crucial pieces of a much larger puzzle. Effective diabetes management isn't a single solution. It's a dynamic interplay of several vital components. It begins with a balanced and mindful diet tailored to your individual needs. It continues with regular physical activity that you enjoy and can sustain. It absolutely requires consistent adherence to your prescribed medication regimen and the guidance of your doctor. And, crucially, it includes strategic vitamin and mineral supplementation when necessary, carefully chosen and properly dosed, to fill the nutritional gaps that diabetes and its treatments can create. Here's an expert tip that cannot be emphasized enough. Your collaboration with your healthcare team is paramount. Do not hesitate to proactively ask your doctor about testing your levels for these vital vitamins, especially if you are experiencing any of the symptoms we've discussed today. Advocate for your health and be an active participant in your care. It's also important to set realistic expectations. Significant improvements, particularly for chronic symptoms like neuropathy or persistent fatigue, may not manifest overnight. Healing and restoration take time. Be patient with your body. Consistently follow your holistic health plan, and diligently monitor the subtle changes and improvements you experience. Your ultimate goal is not just to manage blood sugar, but to slow the progression of the disease, alleviate symptoms, and significantly enhance your long-term quality of life, allowing you to truly thrive. Remember, managing diabetes is a lifelong journey, but you are absolutely not alone in this. By empowering yourself with accurate knowledge and the right tools, you can absolutely reclaim control, enjoy a more energetic and vibrant life, and achieve better health every single day. This is about living well, not just living. If you felt a spark of inspiration or recognized some of the vitamin deficiency signs we've shared today, then this video has achieved its purpose. We believe this information can be a powerful catalyst for positive change in your life. Now, we want to hear from you. Which of these 3 critical vitamins surprised you the most with its profound impact on diabetes management? Please share your thoughts, your experiences, or any questions you might have in the comments section below. Your story matters, and your insights can truly help others in our community. If you found this video helpful, please show your support by hitting that like button. It helps our channel reach more people who need this vital information. And even more importantly, please share this video with your loved ones, especially anyone you know who might be struggling with diabetes. A small share from you could bring immense hope and practical solutions to someone in need. Don't forget to subscribe to our channel and click that notification bell so you won't miss out on our upcoming valuable health content. Together, let's build a healthier, more vibrant, and more informed community. Thank you so much for watching. Always prioritize your health. It's your most valuable asset. We look forward to seeing you in our next video.